Hello and welcome to Rise, Hope and Healing After Sexual Betrayal. If you're just joining us and you've just discovered betrayal, we invite you to check out our Season 1, which was created specifically with you in mind. And it also has a companion online course at humanintimacy.com. If our conversation today is helpful for you, we invite you to share it so that others don't have to walk alone. We are so glad that you're here. Welcome to Rise, Hope and Healing After Sexual Betrayal. I'm Marianne Michaelis, and today I am honored to have Dan Oakes join me for a conversation. Dan is a licensed professional counselor. He is a certified sex addiction therapist and a clinically certified sex offender therapist. And Dan, you've been doing that for 25, 30 years, right?
Yeah, 30 plus.
Okay. He holds a Master's of Education in Counseling and is the founder and clinical director of the Arizona Family Institute in Mesa, Arizona, an attachment-based practice specializing in couples work, betrayal trauma, sexual abuse, and the treatment of compulsive sexual behavior. A couple weeks ago, I had the pleasure of spending the day just getting to know Dan and walked away enlightened and really excited. And Dan, I really loved your attachment work and frame that you look at this work through. And so I'm really excited today to have some conversations about that. But I'd love to have you introduce yourself. What have you been working on? I know you've got an intensive for some men coming up. I'd love to hear you share a little bit about that if you'd like to.
It's really an honor to be with you, Marianne, and a privilege to be on your podcast and have met you a few weeks ago. That was a great privilege. And I felt the same, felt enlightened by our opportunity to interact and privileged to be here. And yeah, I am the founder and director of the Arizona Family Institute. It's a private mental health practice here in Mesa, Arizona. And we focus on family themes, sexual addiction, betrayal repair, couples counseling. Several of us are CSATs, and most of us are all trained in Manuela model. And once there's some stabilization and they're beginning to repair things, I tend to do the couples work when they're ready for that. And we have an intensive coming up for men called Shift. We use the word shift because we believe there has to be a shift in betrayal where we go from shame and harm to integrity and fidelity and truth, SHIFT, right? And we're helping men move into a place of accountability, transparency, integrity, so that they can be clear about the abusive nature of some of their behaviors and the pain and reality fragmentation they've caused in their families or lives, and help them find a path to healing through transparency and integrity. That's coming up in the third week of July. So we're super excited about that.
We'll have a link in our show notes for anybody who might be
Okay.
interested in checking that out. Are there any requirements?
Just a screening to check for readiness. We want to invite people that are ready for real change and have some clarity about where they've been and what they've done, and that are ready to make that shift. And as they signal readiness for that, then we'll bring them into the program. And it's a 3-day intensive, a Thursday, Friday, Saturday. We're excited. It is the first in-person intensive based on the Manuela model. Most of those are all Zoom based. So we're excited to be in person.
That sounds like it'll be fantastic.
Yeah.
I heard you talk about couples counseling, and this is a podcast about betrayal trauma and about healing. And oftentimes I have clients say, when do we do couples counseling? And so when is somebody ready for couples counseling? What does that look like? Can you give us an outline of how you determine?
Yeah, well, I think sometimes it's less about what we determine as a clinician, but we take the cue from the couple when they start being interested, and specifically the hurt spouse. We want whoever is the hurt partner in that scenario to be the driver of readiness. Sometimes there can be re-traumatization and harm if we push too quickly, but we're waiting for a signal from the hurt spouse that they feel ready for some integration work. And we know the hallmark of that betrayal work is that a hurt spouse may want to reconnect, but their body and their nervous system makes that very difficult. The pain that they feel, the intrusive thoughts, the PTSD symptoms, those things are difficult. And once it gets to a point where the hurt spouse is saying, these are in my way and I want to reconnect, and especially if she feels like she's got some stability on her own and she's got a safe place to return to, then we'll start that work. We'll try to open some doors and do a assessment and see what's needed and what they're ready for. And we let them guide that path. Sometimes they come together and after some good work, they discover divorce is the answer. There's not a preset determination of what a good outcome is. Our goal is safety, integrity, and truth. And when that can show up, then people can heal, whichever direction that goes.
So there's not necessarily a checklist, but if I've been betrayed and I can't handle sitting in a room with my partner or looking them in the eyes, or I'm just so hurt by everything that they say, I might need to do a little bit more work just to calm down my reactions and my PTSD and get some
Right.
help working on some of that so that I can show up effectively to start working on addressing the attachment wounds that have
A-
occurred.
Yes, absolutely. And I'm strict about I won't do couples work if the offending spouse is still acting out. I need to have some signal of readiness from the offending partner that they're in stabilization, that they have some control over their compulsive behaviors, that disclosures already happened, that we know where he's at. Oftentimes in our program, I will require a polygraph before we get to that point, and that's not always required, but in cases where there's mitigating circumstances, I often do. So we need to ensure as much as possible some safety for that work to be effective. And many times the offending spouse will want to engage it and say, look, disclose to me that you haven't shared everything or you've slipped again, and we're not going to do that until you're honest. And so that's their readiness in terms of ability to show up in a safe way and with transparency. So it's not so much a slip would disqualify them, but the hiding of that slip or the hiding of almost any behavior, we would say we're not going to promote reconnection until there's safety.
Yes, because the whole crux of betrayal trauma is there's been hiding,
Yep.
deception, and secrecy in the relationship. And that damages, that hurts our partner. And so until that's addressed, until there's full honesty, it's really hard to attach in a space where there are secrets and hiding.
Right.
Right.
Now, I will say sometimes we'll do some couples counseling before that in preparation for disclosure, for boundary setting. But couples work associated with reintegration will wait for there to be some established safety. And I think another important thing to say there is that the clinicians, we're not the arbiters of deciding who's truthful or not. We may require a polygraph because we think the client needs it. So we're trying to facilitate it, but not dictate it. That's the goal.
I think that readiness also ties into readiness to connect, readiness to do the work. Because if I'm showing up and I'm really resistant or I'm really angry with my spouse, if I'm the betrayer, that anger is going to
Right.
be a really big problem. If I've got resentments, that's not a place to really connect in. And so there is that work that we've got to do. So we're both in a place showing up ready to both do work because I would say
Right.
couples counseling is work. It
It
brings
is.
everything to the surface and it's difficult work.
And it needs to be, right? It needs to be an opportunity for some of that anticipated pain to show up so that we can develop new corrective emotional experiences around reintegration and how they show up for each other. And I use he euphemistically in terms of that's often who the betrayer is, but not always how he can attend and respond to fears and dysregulation and how she's ready to talk about those things and reestablish some pathways for reconnection. And those are scary things. And sometimes couples are just really ready and they just need a little facilitation. And other times there's just huge amounts of fear and we just want to make it as safe as possible.
You mentioned before, sometimes we do some other work before we're doing the attachment work. Sometimes there are some skills that need to be learned. We need
Correct.
to learn how to have a conversation. We need to learn how to own our emotions. We
Yep.
need to learn how do I show up and share that with you in a
Right.
way that's not going to be damaging to our relationship as well. And so sometimes when we're looking at couples counseling, it's just let's teach you how to relate to each other before we can even start diving into
Yeah.
the deeper emotions. Because if I don't have that skill set, it's really hard for me to tell you how I'm feeling if I don't know how I'm feeling.
Yeah.
Yes.
Absolutely. I think one of the things that's unique about betrayal work is its juxtaposition to regular couples work. And I think what I mean by that is if anybody's trained in EFT, we know that regular couples work, there's an even playing field, right? Each party's coming to a place of accountability and they're trying to work out that attachment mechanism that's gotten sideways for them. But in betrayal work, it's not even. There's been harm. And so there's a little bit of sophistication in that work because there's a hurt spouse and attending work to be done. But in certain moments, we will see that emotional cycle that they both get stuck in. And so we'll move in and out of what looks like regular couples work because they're stuck in an emotional place. We might use an EFT strategy there and then move back into the betrayal work. And I think one of the things I have found really helpful for couples is to call that out, to say it, and to put it on the table so they know, oh, here's an emotional element that's about your interaction and how you trigger each other. And the way you trigger each other is very equal, but the conditions that produce this are not, right? And some of these things will exist before the betrayal, some after, but our ability to identify and declare and share what is and what isn't the category of the work. That's important, I think, because my experience is as couples get better and heal, like today, I saw a couple that I've seen for 3 years and they're really in a great place. They've come a long way. And I'll say to them, wow, a lot of your conflicts are feeling more normative. It means the big wounds are really healing and you're having the kinds of conflicts that couples have. And it's actually a sign of progress because they're healing from the betrayed space and then having those normal conflicts that we all have when we're trying to work out our emotions and tensions with each other. And being able to call that out in a sophisticated, clear way is really helpful for couples.
But what I heard being communicated that wasn't necessarily the words that you used was couples work is really difficult, very sensitive work.
Hmm.
And sometimes I know individuals will say, well, this person's trained in EFT and they do couples work.
Hmm.
And there are elements of those tools that can be helpful. However, when there has been betrayal, you often need someone who's highly specialized in working with the betrayal components and the other tools as well. But it's like another level.
I think so. And not everybody in our field agrees with that, but I certainly do. And I agree with you in that. And it does require training. And I've seen couples who come where the hurt spouse came from another therapist where they were told, no, it's even. You're not showing up. And their PTSD symptoms get classified as you're not showing up for the work. And that's re-traumatizing and it's harmful in my opinion. And it's tricky. And sometimes clinicians don't know what they don't know.
Oh, I agree with that. There's a lot I don't know. I'm learning every day.
Right.
So, when we met a couple of weeks ago, you shared with me your perspective or your take on the attachment model coming from a needs space. I would really love to hear you share that. And if you can share it from how you see that for somebody struggling with sexual addiction or compulsion behaviors or sexual acting out behaviors, and also how you see that from a betrayed partner's recovery path.
I think those are great questions, and it is unique to my perspective and how I do the work. And there's something I do with the sexual addict, or I don't like the A word. It is technically accurate, but my perspective is that it is an attachment disorder. And there's some good research around this idea.
Let me clarify. I just want to make sure for our listeners and our viewers, that you're referring to the word addict. And you're
Mhm.
saying that addiction, when we're using that word addiction, your perspective or the view that you have, your lens is that addiction is an attachment disorder.
Correct.
Okay.
I'm saying the treatment of it historically is willpower based. And maybe if you're in a 12-step program, higher power based, but it doesn't sufficiently, in my opinion, address the attachment misalignments that got created that caused the addiction. And I'm not minimizing addiction at all. I'm just saying that attachment, language, and treatment are much more effective, at least in my experience, in helping those overcome it. And I think there's this stage in early recoveries, especially in the addiction model, in the addiction language, like, well, I don't know why I do it. I can't explain it. I'm just an addict. And so the word becomes the explanation of the why. I think it's wholly insufficient. In my opinion, that provides no solace for a hurt spouse. If I say, I don't know why, then what my hurt spouse is going to say, well, if you don't know, then you can't change it. You can't control it. You mentioned at the beginning that I'm also a clinically certified sex offender treatment specialist. And I remember interviewing an offender before he went to court. I was in a jail interviewing him, seeing if he was eligible for treatment. And he was about to go into court. And I said, well, tell me about your history, why you think you did these things. Oh, I have no idea. I said, well, listen, if you go tell the judge that, then you become the most unsafe person ever. Because if we can't identify emotions and behaviors and change them, and it's all a mystery, then there's no way to make movement. So the attachment model provides the explanation. I tell men when I work with them, what I never want you to hear you say again is you don't know why this is happening. And let me give a brief explanation about what that is. So the research is very clear about this. Our nervous system is designed to emotionally regulate through our connection with other human beings. If you read Alan Shore's work or other researchers, this is well known in the research. So our nervous system is born this way. It happens the day we're born, we come out screaming. And the soothing thing to do is to hold that baby close, feed it, care for it, and the regulatory system calms down. This co-regulation experience. This part of our nervous system never goes away in our life. It grows up, it becomes more sophisticated, but our nervous system needs a secure base. It needs a place to go. It needs a place to anchor, and our ability to auto-regulate, to regulate our emotions independently, is developmentally dependent on having that secure base. And so what happens is that at some point in our life, the individual will engage in behavior that has what we would call excessive dopaminergic effect. One client said, well, when I was 11, my older brother's best friend got me high for the first time. And after that, every time I got anxious or worried or down, I went and got high. I didn't go to my parents anymore. Or boys will say, well, when I found porn, then after that, any emotional distress, I went to porn. And so there's a hijacking of that regulatory attachment system, because the parts of our brain that are associated with pleasure and the parts of our brain associated with emotional relationships are essentially the same parts of the brain.
And that's our
So,
reward system where we get the dopamine, because
yes,
the dopamine drives us to connect, because that's our safety and security.
absolutely, 100%. And I could add to that and say that most of the hijacking vehicles of excessive dopamine in our culture are all man-made. Excessive dopamine doesn't really exist in nature. Alcohol is man-made. Even marijuana is hyperstimulated or distilled. Pornography is man-made. So these excessive forms of dopamine hijack it. Now, here's why that's pertinent. I think sometimes we overthink that addiction is the result of trauma. Well, yes, that can be true, but it doesn't take much exposure to an excessive dopamine event, or let's say pornography, for it to hijack the part of my brain that when I feel distress, I run to the behavior rather than other people. And so when a person that struggles with compulsive behavior can explain to themselves and others, then they can explain the story. Oh, when I was 11, I started this. When I was 14, I started doing this. And the story of how that became their secure base. The system is still an attachment system. And that attachment system you can't stop. And so in addiction work, the old willpower models just aren't effective. You try to tell your nervous system to quit attaching, what you attach to is irrelevant. It cannot stop attaching. That's how it emotionally regulates. And so willpower models are notoriously ineffective. And so when an individual starts to see the attachment mechanism, then we are more precise in the interventions and corrective emotional experiences to realign the attachment model away from these excessive dopamine, pornography, or to a drug back to emotional relationships. And that connection is so thorough that when we grow up and get it normally, when we don't get it hijacked by intrusive things in the world, it's a connection that initiates with other, and then that grows into a connection to self. And as we mature, a connection to a higher power or to God or to purpose. I have clients that are atheists, and we talk about this third stage of connection to purpose. And so those realignments of the attachment mechanisms and the work, it changes the corrective emotional experience. The interventions are attachment based, what it means to reach out, what it means to meditate and connect with self, what it means to feel experiential love and closeness, right? My experience has been that when the hurt spouse hears this explanation, it resonates with them in a way where they're like, oh, this makes so much more sense to me. And the ante goes up for the offending spouse because it means if he stays in silence, even if he says, well, I'm not acting out, but she says, well, he doesn't talk or connect or he doesn't reach. Well, okay, maybe he's white knuckling it, but we're not reestablishing attachment mechanisms.
So going back to that young youth, especially the world that we live in today, if you were born in the 2000s, you're a digital native.
Right.
And the
Great.
world looks very different.
Right.
And if I learned when I was young to turn to, if I attached to something else, what it
Yes.
means is I probably didn't learn the tools that I needed to communicate, to honor, or learn how to regulate my emotions because I've just got this great band-aid of dopamine that I turn to. And so these are the tools and the skills that have to be learned. And I think this goes back to that earlier part of our conversation. To be ready or stepping into that couple space, there's some re-education that needs to happen
Absolutely.
as well.
That couples work is designed to facilitate that new reattachment. And we do it baby steps, rebuilding trust as we go, more clarity, more transparency, more authenticity. And that takes some time and it takes mitigated effort where everybody is treated with dignity. The hurt spouse, most of all, the offending spouse has to be treated with dignity as well. While they acknowledge the abusive, deceptive behavior that they engage in, they also deserve dignity in that process.
Mhm.
And that's our role as clinicians to show up and to model that dignity so that repair can be made.
I love how you shared this is what it looks like for the person who's been struggling with unwanted sexual behaviors. I'd love to flip around and let's talk about the attachment system or the impact of the betrayal on the attachment system of the betrayed partner.
So that's the other side of the page, right? So often, not always, but often, the hurt partner is now engaged in a fearful, avoidant attachment structure. They want reconnection, but their nervous system makes it difficult. And so, what we're doing in that work, to be overly simplistic, is a little bit of phobia work. It's exposure therapy. Let me give you an analogy there. If somebody says, I'm scared of spiders, I might get a picture of a spider and put it over here on the wall. And then they're going to panic and we wait. And their nervous system calms down and they say, oh, I'm okay now. So we move it closer. And they panic and it calms down. And then we move it closer. But you can only do that if the person is saying, I want to not freak out when I see a spider.
And I would add to that you are there with them, supporting them. You are taking part of that attachment role there of being that safe person for them too.
Right. We're going to regulate it and move it slowly and safely. We'll never go beyond where they want it to. right? And calling it phobia work doesn't do it justice because nobody's in love with a spider, for heaven's sakes. But it's not uncommon for your nervous system to react negatively to being near somebody that you love but has hurt you, right? I had 3 older brothers, and we used to play this game when I was a kid called Make You Flinch, and that just meant they had permission to hit me, and then later act like they were gonna hit me and watch me flinch and laugh. And it was innocent, it wasn't abusive. But the partner will want connection, and they feel that flinch and that fear and that worry and that dread. And so the attachment process is about helping the offending spouse model attending behaviors. I can attend to your fear, seek your fear, and then the ability to hold the fear.
So let me slow this down. This is so difficult if I've had trickle truth, I've had gaslighting.
Absolutely.
So it can be one step forward and two back. It would be great if it were a linear process, but at least in my experience, oftentimes my clients who've acted out outside of their value systems when they've hurt their spouse or partner, it doesn't always stop immediately. And there's regression of behaviors. And okay, we got the spider a little bit closer. We got a little bit closer, but hold on a second. Now I'm hurt again. And it can also push further back because that was not safe for me.
Right. And that's exactly the point. That is the purpose and function. It is the fact that the trickle disclosure, the gaslighting, the omission, the lying, these are the things that are more harmful. Almost every woman I've ever worked with says this to me. I can handle the sexual addiction, but the lying, the hiding, this is what makes them unpredictable and unsafe, right? The behavior too, but that's exactly the case. And so now his attempt to show up in a new way, if he can do it, is going to be met with that insecurity and fear and avoidance. And that's what we move really slowly with. And I like to call it slicing it really thin. We find the smallest level of vulnerability and connection that's possible. We re-engage it, and then we back up and talk about it and ground and re-solidify, and then maybe do it again. Taking safety cues from the hurt spouse, listening carefully to the pace with which they need to go. And my experience is that spouses that have been injured in that way, they're impatient with themselves. They're often pushing themselves faster. And sometimes we need to give them permission to slow down and that it's okay to still be scared. And they will even feel shame, like, well, I'm supposed to forgive. We're like, oh, of course, you've already done that. You're in the room. This is not about forgiveness or lack thereof. This is your nervous system doing its job, and we honor it and we want it present. We don't want to shame it. We don't want to push it away. She will need that to protect herself from further harm. So we have to resolve those things in a way that allows for our nervous system to continue to protect.
I want to circle back. One of the things that caught my ear is you talked about most of the time partners who've been betrayed often have a fearful, anxious, or avoidant attachment, or that's the space that they are
Yeah.
in this relationship.
Mm.
I also work through an attachment lens, and one of the difficult areas that I've struggled with is we often say, well, there's 4 different attachment types. Yet what I see is in different relationships, individuals can have a different attachment type. And I want to make that really clear because you talked about that fearful avoidant. That doesn't mean that the partner always had that attachment type, but this may be a direct cause of the betrayal. And I want to understand your thoughts as you're saying we're working on this healing, we're working on changing and building this into a new secure attachment. Did I hear that right?
Exactly. And I think we do this thing in psychology in general where everything is state dependent and identity based. And I don't believe that attachment styles are adaptive. They
Mhm.
show up when they're needed. Maybe we grew up in a home that required one adaptive way, and then I get married in a relationship and my attachment style changes there. And so what I am saying is when somebody is traumatized or hurt or pain, often, not always, often they will develop fearful avoidant attachment styles. And that's a conditional protective response that is not a weakness.
It's just a coping survival skill. I don't know if I can trust you.
Absolutely. And that's the goal. What we're doing is trying to provide the corrective emotional experiences to help them get back to a secure base. And so the caveat there is, what is a secure base? Well, a secure base doesn't mean I'm absent fear. It means I can say I'm scared and somebody will care and respond. That's a secure base. It doesn't mean I'm absent fear. It means that fear is embraced, fear is
I
heard.
As part of this conversation, I'm also hearing if my partner, the betrayer, if they aren't safe for me to attach to right now because I'm doing this step forwards, couple steps back, back and forth, outside supports become so important
Absolutely.
because I've got to have stabilization coming from someplace because from this attachment needs place, if my partner can't provide that for me, I absolutely have to have other people that I can fully show up to.
What you're describing there is a conditional response. So a hurt spouse may be grounded in their body, they have good support and people, but when they get near their partner or hear their voice or see them on their phone, or then that trauma response shows up in those fearful avoidant ways. And man, the amount of pain that causes is profound, and it has to be attended to.
There's an underlying theme that we're also talking about here. This is all about our nervous system predicting safety. As I get near this partner who's hurt me, my nervous system screams out, oh no, I'm going to get hurt again. And so, as we talk about the PTSD criteria, the I want to avoid you or I want to avoid other people because I'm afraid I'm going to get hurt. I have intrusive thoughts or I can't sleep because my nervous system is reacting and responding. So if I'm sharing the bed with my partner and they've hurt me, boy, it might be harder for me to sleep, or my subconscious might be saying, like, hold on a second, my nervous system is trying to settle, but I'm lying next to my partner who might not feel safe for me right now.
Absolutely. And that's a pervasive experience. And for them to be able to describe and communicate what those fears look like, in my experience, one of the hallmarks of couples who are more successful than others is that the hurt spouse finds conditions in the relationship that she can share fear openly, and that the offending spouse can respond to the fear and attend to it calmly without defensiveness or blame. If that one set of condition isn't in place, it's not going to heal.
Hold on, I
Eh,
want to make sure we say that one more time because if I were listening to this, I'd be like, wait, what? What was that? Let me go back and
Right.
hear that again. So
Yeah.
you said the betrayed partner needs to be able to find a space where they can
Mm.
openly share, here's where I'm at, here are my fears. And the betraying partner would receive it and respond in a calm way. Did I catch that right?
Yes. And one word I said, it's not that she needs to, it's that conditions are created that she's able to.
Mm.
The conditions are created by his accountability and management of his reactivity. Because what's very common in the beginning of that work is when the spouse gets hurt, he gets defensive and frustrated and says things like, "You're never going to forgive me. You're living in the past." You know, they say these things because they don't know what to do. They don't know how to hold space for the fear. And maybe they're not in full accountability yet. But that's the condition. And this one condition that I'm describing is most relevant to long-term success. It's not the only condition, but in my experience, when couples can do that, then the doors open for the possibility of long-term repair. And what spars that capacity? How does he create the condition? It is his ability to seek the fear. Because in the early stages of recovery for the guy, they're still dealing with their own troubled sense of self and the addiction and managing all of that. And their wife's fear is the last thing they want to see. All their shame comes up and they might get defensive or avoidant. And we see this in the beginning stages of all of this. But once there's a shift, once he gets to a place and learns this skill, once his behaviors are safer and he can seek her fear, he's not waiting around hoping it doesn't go up. He says, hey, how's your fear today? We've been together a lot today. I'm sure that I've triggered you in some ways. How's your fear? I do want to know.
Okay, I want to back this up. I'm trying to make some connections here. So if we're saying that addiction, addictive behaviors, these sexual acting out behaviors, if we're saying these are an attachment disorder, and then we're saying the secret sauce is seeking the betrayed partner's fear, I'm hearing that and I'm thinking, hold on a second. If they have an attachment disorder, that's going to be really hard for them to step in a place of saying, hey, now I'm a great attacher. And so there's some steps in their work that they have to do, which is learning how to connect, creating their support structures, learning how to have healthy, safe attachment also outside of this primary relationship. Because when they seek that fear, as you said, the conditions are this is a safe place. It doesn't mean that you're going to show up and share with me. I'm going to seek it. But what happens if you lash out at me? If
Right.
this is an attachment thing, I'm not going to be great at attaching. And that's the core of all of this. This is what I'm trying to make sense of. I bet you can probably put that together a little bit more cohesively. How would you present that?
You're exactly right. You're correct in that it usually doesn't show up right away. He's doing a lot of his work on his own, getting to the place where he can create the conditions for change in his own life and then also in the life of his partner. So I'm implying, again, remember I said I don't even allow him in the room with her in my office until he's demonstrated capacity to do that. And even when we talk about these skills, I'll say to the offending spouse, listen, if you learn these skills and do them well and you continue to harm her, she will see you as sociopathic. There won't be a path for healing. If you're so disconnected internally that you can show up with empathy and attend to her fear and then hurt her again, you're working on really thin ice. And so you're exactly right. There's a lot of prerequisites. So you're right in that it's not the secret sauce because there's a lot of work to get to it. But once they're both in readiness and once they're there, that's a skill that has to be learned in order for long-term progress to be in place.
And I want to really highlight that they're not going to be good at it. And I tell my clients it's kind of like putting paper bags over two people's heads and saying, now I want you to find the door and get out of the room. They're banging up against each other, not because they want to, but I don't know how to do this. You don't know how to do this. We've never done this in our relationship in healthy ways.
It's funny you say that because one of the things we do in those early sessions is talk about this developmental pattern of competency. In the beginning, we don't even know the skill we need. This is the first stage. There's 4 stages in that pattern of developmental competency. At first, we don't know the skill we need. And then second, once we learn the skill, we are really crappy at it and we don't like doing it. It's uncomfortable. And then we know the skill and it's working, but it takes a great deal of effort to do. And then we do that for a long time. And then it becomes a competency where I don't have to think much about it. It's natural. And so this stage in any learning, especially in emotional learning, is this competency developmental stage. And when couples know that, then we will say, oh, this is the stage where you're going to hate doing this. Guys will say, I'm ready. I want to do it. I said, yeah, it's going to be really uncomfortable for you. And in the session, I'll model it. I'll give them tone and some language and they'll do it. And she'll say, it doesn't feel authentic. No, of course not. Of course not. You don't believe him yet. No, he's just saying what you told him to say. Yes. Yes, of course. Right. And so that competency stage has to be gone through. And when we slow it down and we spell out the developmental process of learning new emotional skills, they see it coming and we anticipate it for them. And it does get better. What happens in those moments is if they do it effectively, as we're training it and helping it, you watch couples' nervous systems calm down right in the session when he finally learns to practice language of attending and listening and caring. And she develops openness to sharing the fears. You'll see it calm down. And in the safety of the session, it doesn't always translate when they get home. So we come back and do it again until they can do it in their natural spaces. And it's repairing the natural attachment structure that their nervous system was intended to have. And it's going to have new edges. There's going to be bumps along the way because the past is still present. Their capacity to do it grows. One of my favorite questions from the offending spouse is, how long is this going to take? And I love that question. And they are initially discouraged because I say, I'm not sure what you mean. Is it going to be your whole life? Is it going to be my whole life? I'm like, yes, but listen, here's what it's going to be. It's going to get so natural that when you're 80 and you're sitting on the porch in your rocking chairs, I'm being stereotypical, of course, that she'll reach over and say, hey, I got a little nervous today when you were talking to that lady at the grocery store. I just wanted you to know I was a little scared. And you're going to say, sweetie, I'm so sorry. What can I do right now to help you feel more safe? Is there anything you need from me? And she'll say, no, I just needed to say it. And you'll say, you can always say it when you're scared. I want to hear. And I say, it will feel then sweet. She'll be glad she can say it. You'll be glad she can say it, and you'll be glad to attend to it. But it's not like it all disappears and we sweep it under the rug and you never talk about it again. A secure attachment isn't the absence of things, it's the openness and transparency of things. That's what it is.
That was really beautiful. And I laughed when you brought that up because I had a client just yesterday say, am I ever going to be done with this recovery stuff?
Right.
And I said, am I ever going to be done with having more fulfilling relationships and
Right.
deepening my relationships? Like, why would you want to be done with that? That doesn't make sense to me because that is what attachment is about. That is what recovery is about. We're recovering the loss of self and the loss of the relationship.
And that's a great analogy because that's what normal life is. Will you ever stop needing the reassurance and validation of a loving partner who can soothe the fear, comfort when it's needed, and respond to your request? Will that ever go away? No. And I hope not. I don't want mine to go. I want to be able to tell my wife, hey, I need a little reassurance today. And she'll be like, sure, what can I do? That doesn't really go away.
Dan, and I'm so grateful for having had this conversation. Do you have any last messages, anything that you'd like to share before we wrap up today?
I like metaphors a lot. And I tell men all the time that this is mountain work. And men love to climb mountains. They love the adventure. If you can see and then you can get a glimpse, the work required to heal and attend, for what purpose? The purpose is that somewhere on the mountain, we're going to have a base camp. And it's our camp, it's her camp, it's my camp. We're going to have a tent, we're going to have a fire. And I'm going to put logs on that fire that's going to burn bright in our relationship. I'm going to feed the fire, and it's going to be our safe place. And then in the mornings, we have to get up and we go do life. We climb the mountain, we do the things we have to do. We attend to each other, we come back, and we put logs on the fire with each other. We feed our relationship. And this is what couples do. Couples that attach for life learn how to climb mountains together. They learn how to feed the fire together. So as we reframe it in an attachment mechanism, the language can normalize and become hopeful and clear. And it's not just a problem to be solved, it's a life to live, it's a relationship to have. As we repair and refine the pains that have been caused and the hurts that have been had, and we find peaceful places again together. That's what it's about. And that's what it's about everywhere. Human intimacy and our need for safety and connection exists in the workplace. It exists on the street. That's why we have painted lines on the street so we can all drive safely together. And it's what the Harvard 100-year study says why people live longer is because they have relationships. I tell couples all the time, why do we want to repair this? Because we want you to live as long as you can possibly live. And we do that in the context of loving relationships. So I think when we elevate it to an attachment model, I think there's purpose in it. It's good psychology. It's good spirituality. It's good for our body and good for our health. And it's good for each other. It's good for couples who find repair. And sometimes it's good when they don't.
Dan, I'm really grateful to you for the conversation, for your time. To our listeners and viewers, we'll have Dan's contact information, some information about the men's intensive that's coming up
Sure.
in mid-July in our show notes. And thank you so much for the conversation, Dan, and we will see you soon.
Absolutely my pleasure. Thank you, Mary.